What hidden curriculum means to me is just all the stuff that you don't really notice that you're learning.
It says it in the name and it kind of doesn't. You don't really know what it is before you start it, but it's the things you're kind of being taught, the things you're experiencing, the things you're kind of put through in your training that aren't really discussed and aren't really tested on shelves, written tests, anything.
The differences that we see and experience between what we're taught that we're supposed to do and then what we actually see being done in clinical practice.
It's about all the things that happen in the hospital that you don't quite know how to respond to or where you could have a safe forum to discuss it. So how do you feel when that obese patient's under anesthesia and everyone's saying things about their body?
While each one of your experiences will be unique, you'll see that there are a lot of common themes that run throughout all of our experiences. From the best days, the worst days, to thoughts of, I can't do this, or I don't know what I'm doing, to thoughts of, I got this.
Be a very shiny, perfect version of yourself at all times and constantly impress people on an interpersonal level, which is really strange because you come from being tested just for what you know, where all of a sudden it's not just what you know, it's who you are, and that can get really, really stressful.
Finding my people, because you go through third year, having to fake interest sometimes in things you're not particularly interested in. But then you find the thing that you like, and it's amazing.
Because you finally get to start carving out your own little spot in medicine, and you get to start practicing and seeing what your future identity as a provider is going to be like, which is amazing.
I found a lot of comfort in hidden curriculum. It was kind of the one thing that was constant among a lot of changing rotations and people. And nobody, it feels like, remembers what it's like to be a third-year medical student, kind of figuring things out and being exposed to so many different things.
I think that it is a great time to kind of get in touch with your vulnerability, because hidden curriculum, hearing about our attending leaders of the group, hearing about their anxieties and vulnerabilities too, because I think especially at the attending level in the clinic, there's always this image of like they're the ones in charge, and often I don't hear them be vulnerable.
After a death of a patient that I had that I was close to and participated in a code for, and it was nice to be able to sit down with my hidden curriculum group and really go through and process that experience and how I was feeling without really feeling judged or without feeling like I was crazy.
It is designed to maybe show you some of the darker sides that you might experience in medicine, whether that's mistreatment, racism, those kinds of things, but also really good things such as mindfulness, ways that you can keep yourself grounded, ways you can keep yourself from burning out.
Talk about your frustrations, your victories in third year, and
just like preserve mental health.
Like finding, meaning and your passion for medicine.
It's a chance to decompress and reflect.
It's a time to reflect on some of the more difficult experiences you've had throughout third year, or being embarrassed or belittled.
Third year at times can feel really isolating. Either hard things happen in clinic or things happen in life that interfere with your ability to be a student or your ability to concentrate. Remember that you're still a person, and med school is obviously important, but self-care is also important.
And if you have a great family and support, or friends and family support system outside of medicine, sometimes it's really hard to be able to discuss and talk about what you're going through day to day with them, because they can be there for you, but sometimes unless you've really been through that exact moment or been through those experiences, it's really hard to relate.
We had dedicated time each meeting to go around and talk about the positives of third year. This is a good requirement, and it should make your third year experience that much better.
Hidden curriculum is all about you.
This is Salida, my puppy.